Hi, I'm Jeff Todd, President and CEO at Prevent Blindness, and welcome to the Focus on Eye Health Expert Series. Here at Prevent Blindness, we recognize February as Low Vision Awareness Month. Today I have joining me a residency-trained low vision doctor in the area of low vision. Dr. Tracy Williams is Executive Director at the Spectrios Institute for Low Vision. He's also the Clinical Professor of Ophthalmology at Loyola University. Here at Prevent Blindness, we're so proud to say that he's also a member of our Prevent Blindness Board of Directors and a co-chair of the advisory committee to our Living Well with Low Vision Resource Center. Welcome, Dr. Williams.
Hello there, Jeff Todd. How you doing?
I'm terrific. Thank you. So as we kick this off, so how do you define low vision? And how is it differentiated from visually impaired, or is that the same kind of terminology?
Well, if we start at the very beginning and we think we go to the eye doctor and we're hoping it's just going to be a visit where we get a good report. We might need a pair of glasses to see a little bit better, but we go in and our eyes are healthy and we might need a pair of glasses and then we'll see you back in a year. But sometimes people get the news that there's something wrong with your eyes. And then what happens is you get referred often to a specialist, depending on what layer of your eye is affected. And we're still hoping when we go see that specialist that there's going to be a cure and everything's going to be okay. But sometimes we hear something like there's damage and we're looking to see if there's surgery or drug therapy, something that can fix that. But sometimes the answer is no, but we'll see you back in 3 to 6 months, or we're going to do some more things, and the person's heart kind of sinks and they're wondering, well, what's wrong here? And they might hear the term, you have low vision. So low vision is a term that means that there's permanent vision loss. And we never blow out that candle of hope, hoping that there's going to be a cure, but we can't sit on our hands. What we have to do is we have to address what's going on now with our lives, not just that layer in the eye, but what we want to do is we want to find out what we can do so we can function as best as we possibly can. So I would say to you, think of it like this. It's like a fence. One side of the fence is the medical side, and we're hoping that everything is going to be fine. But sometimes there is damage and we don't have a cure for it. So the till then is to go over to the other side of the fence. It's a co-management model, and we're going to get our low vision evaluation and find out how we can be the best we can be with that vision loss.
That's great. And so then at that point, the patient tends to enter a vision rehabilitation. Can you talk about why vision rehabilitation is so important? And when should someone with potential vision loss begin that process?
Well, let me first of all say that sometimes rehabilitation isn't, again, the word you want to hear, but it is a rehabilitation. Rehabilitation, if you look it up, isn't immediate gratification. It's a process, and the process often involves working on your head, your heart, and your eyes, and it takes a little bit of time. But thank goodness there is rehabilitation for people with vision loss. And so when you get referred over, what's going to happen is there are doctors and other professionals that work together as a team, and they're going to be driven by your goals and needs. But when I say they work on the head, heart, and eyes, the head part is you're probably going to have a lot of questions. And I got good news for you. When you're in the rehab side, there is time to answer all these questions. So the staff can do what we call professional paternalism, where you try to act as a professional, but paternalistically, we're going to help you be the best you can be and use your energy to fill that bucket of fruitfulness, not depression, anger, and frustration. And so it's a process, and it really does focus on what your activities of daily living are and what your career needs. And you're somewhat like an apprentice carpenter at first, where you may not have any tools and you may not have any training, of course. So there's involvement. You need to be a little patient at first, but maybe the music to your ears is, while there's no cure or maybe making it perfect, there is improvement. And improvement is a powerful word. So we don't want people to be depressed, underemployed, unemployed. We want them to get the early intervention. You're asking that, like how soon? As soon as you possibly can. As soon as that diagnosis is made, I think that first of all, it's shock. It's not what you want to hear, but I'm going to tell you, usually when people come here and they begin to see the direction and the hope supported by science that they can now begin to tackle any challenge that they have. And we encourage them to have a little bit of an attitude. We want them never to be defined by the vision loss, but be defined by their head and heart. So we just love it when the person kind of sounds like that little locomotive that said, I think I can.
Thank you for that. And you speak a little bit about the head and the heart as well as the eyes. And there's certainly a lot of discussion around the effects of vision loss and depression, and understandably so. Can you talk a little bit about, based on your experience, how low vision can impact a person's mental health, especially in the early stages?
I think, first of all, if that person with vision loss, with low vision, does not have the intervention where they can be encouraged with the heart, in other words, be motivated and inspired, to take on this rehabilitation. And I think that inspiration, along with bringing a coach, I think it's very important. I think the thing that happens with us, and we encourage this, is a loved one or significant other is accompanying the person with vision loss, because having an extra set of ears is a great thing. There's a lot of things discussed, and I think initially anyone is at first might be a little bit of a selective listener, that they're only hoping to hear that it's going to all go away. But I think when they begin to hear that there is really good direction that can really solve things, it's kind of like, pretend you're a Martian and you're from Mars, and all the Martians have your same vision loss. So they got to go through grade school and high school. But so I think from a cultural standpoint, you don't suffer as much when you begin to shift to say, okay, this is who I am. I'm still here. I feel bad about it. I think grieving is a normal part of the process. But when you have a loved one there too, I think, again, they see the hope. The hope is the key thing. And I think that if a person has no direction, and that's why this co-management model is so important, if you have no hope, that definitely feeds into depression.
So you mentioned, the shock that often comes with this diagnosis, and the importance of having a caregiver with you during doctor's visits, et cetera. Are there questions that people should be asking their doctors when they get this diagnosis, or that their caregivers should be focused on?
I'm going to tell you that doctors are aware now that there are specialists, and there are accredited, often non-for-profit agencies that do a very good job at helping a person climb the mountain again after they've had vision loss. But I think that in this hustle bustle world where the appointments are pretty quick, it is good at times that a person is an advocate for themselves, and that they kind of, when this happens, again, it just knocks you to the canvas. But if you just stop and say, is there a way that I can get help so that I can address my life? When I wake up in the morning, I do personal grooming, and then I walk my 3 dogs, and then I look at my mail, and I look at my newspaper, and then I'm going to eat breakfast, and I used to drive my car. And when you think about it, there's so many activities of daily living, and that's not going to be addressed, on the medical side. And so I think a lot of people are not aware of the fact that just like there are specialists like cornea, retina, pediatrics, neuro, there's all different eye specialists, right? But I'm happy to share with you that there's also a residency trained doctor in low vision. I was actually lucky. I got to train with an ophthalmologist, and I was mentored by many outstanding optometrists that were in the low vision field. And the ophthalmologist that I trained with, she actually coined the term low vision. Her name was Eleanor Fay. And I'm going to tell you that low vision is a treatment modality, just like eye surgery or drug eye therapy. And so I think if the public was more aware of that, you don't have to totally accept having a vision loss and, of course, doing nothing. Okay, you got to accept the vision loss, but we're going to do something. And the sooner you can get into that journey, the better it is. And also, you're not the first one. You're not the first one. And this is what support groups sometimes and other staff can really lift you. Because when you go, oh my gosh, that person is gainfully employed, and oh my gosh, that person is driving with telescopic glasses and it's legal. I just think that there's so many unknowns, but unfortunately, maybe in, 70,000 optometrists and ophthalmologists in the United States, I would guess there's probably only about 300 that are residency trained in low vision.
Yeah. Well, I love what you said about thinking of vision rehabilitation as one of the treatment options that you have available when you're dealing with vision loss. Can you talk a little bit about, I know there are a lot of causes of vision loss and low vision, but can you tell us a little bit about what some of the more common causes are?
Yes, I think in most of the low vision clinics, it's a pretty geriatric scene, so to speak, because with the aging process, people do sometimes lose vision. And one of the most common one you hear, of course, is age-related macular degeneration. And this is more common in Caucasians of European descent. But then, you might hear of people that have diabetic retinopathy. That could be any group, but it seems to happen often in Hispanics. And sometimes you hear about advancing glaucoma when the pressure in the eye is too high. And maybe in the Black or African American group, you see more of that. But it strikes all ages. And I'll share with you that we go out to the schools up and down the state of Illinois, students K through 12th grade, and they may have been born prematurely and had retinopathy of prematurity or genetic types of problems, optic nerve atrophy or albinism. I mean, the list is, unfortunately, it's a pretty long list, and it hits all age groups. But I say to you, again, there is hope supported by science. And so children, when we see them, are so excited to learn if there's any tools you can give them for their toolbox that might enable them to do things themselves. Their whole life is ahead of them. So sometimes having to change your behavior, like, well, I don't like to read, when it's in front of one eye very close. Often a child says, bring it on. If there's something that can help me see. If I go to the zoo and I have a little telescope around my neck and now I can look through it, and oh boy, now I don't have to crawl over the cage to see the lion or ask somebody what it looks like. I can see it myself. And oh my gosh, how about all the access technology that's happening? This is a paradigm shift. I mean, when you have smartphones and tablets that can make, your font size bigger and the contrast better. And come on, you can get vision from your ears and from your fingertips. Get it wherever you can. You're like a football team, passing game, running game, whatever it takes, because it's about being the best that you can be and remaining independent and doing the best you can with what you've got.
Yeah, you mentioned the technology. Gosh, over the last 15, 20 years, the technology's just advanced so much with the smartphones, et cetera. But here at Prevent Blindness, and I know you share this concern, from a policy perspective, we know that many of these devices that can help people with low vision aren't reimbursable. And that's a major concern that we have to face when it comes to providing access to care. Not everyone has equitable access to eye care, and certainly it's the same with low vision.
Yeah, this is really a shame. It's something that needs to change, and I'm so glad that groups like Prevent Blindness are trying to help change this, because when you think of the economic burden to society, which Prevent Blindness has been pretty involved with those studies. When it first came out, I don't know, what was it, over 7 years or whatever it was ago, but 54 billion or whatever it was. And it was funny that there was not only a study out of Johns Hopkins, but also the CDC paralleling it. But that number has rocketed. It's over 100 billion now. And you think of how sad it is that you have, for example, a student in high school that, may be going into disability instead of being a taxpayer, let's say, and being happy with whatever their gift is, being able to be gainfully employed. So I'm saying there's definitely economic implications, but they're not always negative, or don't have to be negative, if we can just invest. And so a low vision workup is kind of like me being a surgeon with the consumer, being consumer driven. And we say, these are the tools, this is the training, and this can really change and help the person actually be contributing and active in society. So why don't we do this? And so it's just been tough. I think historically, that's why when you look at the accredited agencies that do comprehensive multidisciplinary low vision rehabilitation, and even for those that have total blindness, let me just say, even total blindness isn't going to stop this. There's always going to be training and ways, and these are our children or our parents or our friends. That investment is just got to be made. So I'm very thankful for all the groups that are trying to do this. It's too hard to ask, consumers to pay for all that toolbox and training. It's just like a surgery. And it's awfully tough for a lot of these non-for-profits to continue to do their best to raise more and more and more money to try to help this group. We'll do all those things, but it'd be an easier thing if we were a stronger team.
Well, and as you said earlier, this is really a treatment, and we should be covering treatments for health problems such as this. You also mentioned the increasing prevalence of vision problems in this country, and sadly, we know that quite a bit of that is due to the continued rise of diabetes and its effect on the body. And still, surprisingly, so many people don't fully understand the potential of vision loss connected with diabetes. I wonder if you have any thoughts on
yeah, I just think, first of all, I'm so thankful. I had the opportunity to work at the National Eye Institute with the NEHAB, the National Eye Health Education Program, and having the opportunity to work with you and service groups like Lions Clubs International. And, branding and key messages are so important, and we just have to keep on finding the way to share the knowledge with not just the professionals, but with the consumers and their loved ones. And I'll just share with you that this is the term I used before, professional paternalism. And when the focus is just, let's say, the layer of the I, which is the most important thing. But I do think that we have to try to find ways to balance that with helping to teach the person that's affected why they march. You can't always tell a person, march. It's better if you can share with them, inspire them, and give them ownership as to why they march. So a person with diabetic retinopathy, if they don't pay attention to their diet, exercise, all the things that we talk about, what can happen is their plumbing in the back of their eye, the blood vessels can get brittle, and then you have bleeding. And blood is food and oxygen for these photoreceptors, these retinal cells. But if it's not being pumped to the right spots, then these cells get starved off, and the bleeding leads to scarring. And a lot of folks don't even know that the retina and the optic nerve are the only two parts of your eye that are an extension of the brain. And when you have damage for right now, it is gone. So sometimes if a person's given a little pep talk and, said, here's why you do this. And I think that support groups and educational groups, I mean, we've got them, but there's no shortage, right, of sharing knowledge, but also encouragement. So.
Well, thank you for that. And as we wrap up, are there any resources that you would point folks to, whether it's patients who are living with low vision or their caregivers, to learn more about low vision and low vision issues?
Yeah, I think, first of all, there's such a spectrum of wonderful groups. If you just think of it like this, there's a group called Vision Serve, and Vision Serve, you can look this up, is a group of non-for-profits. I think they're all accredited throughout the United States, and their focus is people with vision loss. Another one is, you can think of who the professional providers on the clinical side are. So this would be the ophthalmologist, the optometrist, the occupational therapist, and those professionals that belong to AER, which is like your orientation and mobility specialists, your rehabilitation teachers and counselors. And then there's the whole counseling side. But then there's just service groups. I mean, now you can look up exactly what your diagnosis is. Maybe it's something like albinism. So you can look up NOAA, the National Organization of People with albinism and hypopigmentation. There's so many places to go. This is the one great thing. Well, there's a lot of good things, but this is a good thing where you can Google or you can look these things up. And that's where you're being an advocate for yourself. But don't forget about Prevent Blindness, or there's so many other great national groups, let's say, and I know that we have state affiliates. And so I think that even if you in your own state were troubled, you could even go to state associations too. So I think it's endless, but I think you and I would say to anyone that's watching this, you can get in touch with us. We're here to help you.
Absolutely. And to find out more about low vision issues, you can visit the Living Well with Low Vision resource on the Prevent Blindness website, preventblindness.org. We also have access to patient engagement programs that bring patients together to talk about their common concerns. So there's a wealth of resources on our website. Well, Dr. Williams, thank you so much for taking the time today. I very much appreciate this conversation.
My pleasure. It's always great working with you, Jeff, too. And I think the last thing that I would say is I would say every person that I work with has potential. I think that's really music to the ears. For every one of them does, whether it's their head, their heart, and eyes, and often it's all three. So thanks for having me on today.
Well, that's a great way to end it. Thanks again. Take care.
Bye-bye.
Bye.